Good afternoon, everyone. I am Lisa Lord, and thank you for joining for this COVID-19 update and media conference. The first media conference by the new Minister of Health and Wellness, the Honorable Ian Gooding-Edgell. Joining him today are the Chief Medical Officer, the Most Honorable Dr. Kenneth George, the Director of Medical Services at the Queen Elizabeth Hospital, Dr. Clyde Cave, and Consultant Manager of Home Isolation, Dr. Adana Grandison. And Minister Gooding-Edgell will begin.
Good afternoon to members of the public and members of the media. Let me first begin by thanking my predecessor, the Most Honorable Lieutenant Colonel Jeffrey Bostick, for his sterling leadership of the Ministry of Health and Wellness, and especially his leadership during the COVID-19 pandemic. Let me also thank the several healthcare professionals and frontline workers who continue to help us during this critical period. My purpose at the media briefing is to introduce myself as the new Minister of Health and Wellness. As you know, I will be supported by my Minister of State, Dr. Sonia Brown. As you would appreciate, the Ministry of Health is a very expansive ministry, and I'm still taking briefings from the technical team within the ministry. However, questions can be directed at the Chief Medical Officer, Dr. Kenneth George, Dr. Clyde Cave, Director of Medical Services at the Queen Elizabeth Hospital, and Dr. Adana Grandison. As we continue to monitor and respond to the current surge in COVID-19 cases and simultaneously move towards economic recovery, it's important to recognize that our relative success in managing this pandemic is due to the government's swift yet decisive actions in implementing preventative and protective strategies such as testing, social distancing, mask mandates, and vaccination. We have managed the Alpha, Delta, and now the Omicron waves, and we fully intend to do the same with the latter. At this halfway point in the Omicron surge, the Ministry of Health and Wellness continues to focus on expanding our laboratory capacity, self, home, and institutional isolation, non-pharmacological measures for infection prevention and control, and the promotion of the national vaccine program. We believe, based on current internationally accepted science, boosters offer the best opportunity for reducing severe infections, hospitalizations, and saving precious lives. And we are in the fortunate position in being able to provide such boosters to the Barbadian public. We have unfortunately lost 277 lives, and this represents a case fatality ratio of 0.9, which is indeed lower than all small island developing states, which is currently at 1.5%, and the global average of 2.2. Home isolation and home quarantine will therefore continue to play a critical role in managing the pandemic, with emphasis placed on managing ill persons and those at risk for severe outcomes such as the elderly and those with non-communicable diseases. I wish to caution the public that this health crisis is not yet over, and I therefore urge all Barbadians to continue to faithfully follow the universal precautions against COVID and the measures that have been put in place to safeguard us against this severe disease and death. I will also assure the nation that as Minister of Health and Wellness, I will continue the ministry's agenda for non-COVID healthcare such as mental health reform, non-communicable diseases, climate change, enhancing primary healthcare delivery, environmental health and vector control, promoting a good working environment, promoting policies and programs to support the healthy lifestyles in all sectors of our community, and improving operations of the polyclinic, the psychiatric, the geriatric, and Queen Elizabeth hospitals. We have already demonstrated our clear resolve to see this pandemic through. In relation to the COVID directive, the sole change will be the resumption of in-house dining in restaurants, providing that all infection prevention and controls are in place. The current directive expires on Monday, and the new COVID directive will be for 2 weeks. It is an undoubted honor to be given this ministerial responsibility for health and wellness. In carrying out my duties, I will of course build up the strengths and good work of my predecessor, the Most Honorable Lieutenant Colonel Jeffrey Bostick, and the experience and expertise of the professionals within the ministry. I will also have the benefit and guidance of the Most Honorable Senator Dr. Jerome Walcott, Senior Minister with responsibility for my ministry, and Dr. Sonia Brown, an accomplished medical professional in her own right. My approach to my new duties as Minister of Health and Wellness will be influenced by the management techniques and commercial skills gained from the private sector, from which I came to government. These factors went a long way in helping me bring about improvements enjoyed by the public in my previous assignment as Minister of Transport, Works and Resources. I thank you.
Thank you very much, Minister. Dr. George.
Good afternoon, everyone. And let me start by saying that Barbados continues to record increasing rates of newly confirmed COVID-19 cases. As you are aware by now, the Barbados COVID risk level is evaluated using 3 metrics: the R effective, the case counts, and the positivity rate. The R effective rate today is 1.2, and that suggests that there is spread within our communities. We like that rate to be 1 or less. And in addition, although there has been some fluctuation in our positivity rate, it continues to trend upward, with the highest being recorded at 26%. Many of you may know that I reported 2.5 weeks ago that there was a single case of Omicron in Barbados. I also at the time indicated that preliminary testing done at the Best DeSantis laboratory, based on what we term as S-gene failure, gave a good indication that Omicron was widespread in our communities. To date, we have gotten an additional 17 out of 20 samples from CARFA, and those 17 samples have been positive for Omicron. In addition, we have had close to 100% concordance with the samples done at the Best DeSantis Public Health Laboratory and those of CARFA. The Ministry of Health, within the last 4 to 6 weeks, has produced an Omicron surge plan. The pillars of this plan are self, home, and quarantine isolation, particularly looking at self and home isolation as a method to get us out of our current situation. 2, the protection of the vulnerable. 3, an enhanced vaccination approach, which embraces the use of boosters. 4, risk communication. And 5, engagement in critical stakeholders. I'm here to report that many of the elements I just raised in the surge plan are currently operational. But where we are at as a country, we have outbreaks in several of our institutions, within the geriatric hospital, within the psychiatric hospital. We have 2 nursing homes and 1 children's home. And the spread of infection in these hospitals and nursing homes is testimony to the level of infection within our communities. In addition, you will hear this afternoon that how Queen Elizabeth Hospital is impacted at several of their levels of operation. So we have put some key strategies in place with respect to making sure, first, that the Queen Elizabeth Hospital is given some space to do what it needs to do. What I mean by that is that we are actively going to be rolling out 1 to as high as 3 satellite sites. These satellite sites are not going to be school-based satellite sites. These satellite sites are intended to provide care and support for individuals who are either ill or moderately ill. Remember that we have a coding system. Greens, in home isolation, we have a coding system. Greens, yellows, and reds. Reds go to Harrison's Point or to Sun Bay. The yellows are assessed by Dr. Grandison and her team, and the greens are expected to remain at their premises without leaving their homes for the designated period of isolation. We can manage this type of system, but we need the full cooperation of the public. The last thing the Ministry of Health will like is that persons who are in isolation are breaching the isolation protocols. When you are in isolation, you are deemed to be infectious, and therefore it is highly important that you remain in your homes, at your locations, and stay put. We will continue to work with all our partners. I just would like the country to know that we have had meetings with the Barbados Defense Force, the Royal Barbados Police Force, and other first responders in Barbados to make sure that they have their systems in place to be allowed to respond to the pandemic as we see fit. As the Minister has indicated, this is our third wave, and I am absolutely sure we can get through this together. I have said before that there's some responsibilities on the Ministry of Health side, but really the responsibility to get through this pandemic is to make sure that the public does the tried and tested arrangements that we have indicated in the public on several occasions. Therefore, our metrics are up. Based on our projections, we had some projections by the University of the West Indies, and they indicated a wave of about 8 to 10 weeks. We believe we are in week 4 to 5, so I believe we are somewhere in the middle, and I will hope shortly that our numbers start to trend back downwards. So those are my opening words, and I hope that my message goes to every Barbadian household that we all have to play our part in managing disease at this point in time. Thank you so much.
And thank you, Dr. George. Now, Dr. Cave will provide an update regarding what is happening at the Queen Elizabeth Hospital. Dr. Cave?
Good afternoon, and thank you very much for this opportunity to welcome the Minister publicly to his new ministry and to the Queen Elizabeth Hospital. Ever since the hospital opened its doors in 1964, not for a single day have we ever deserted the people of Barbados in caring for their health needs. We've done that through natural disasters, through mass casualties. Particularly, we have stood by individuals and their families and their health crises, and this COVID pandemic is no different. For almost 2 years, we have stood by the country and evolved and changed as needs be. I am particularly proud that we have not ceased any of our essential services. Certainly, we have had to slow them down and at times pause, but unlike many of our Caribbean countries, we have endeavored successfully to keep our main hospital relatively COVID-free and to maintain our non-COVID services. As you will appreciate, the COVID pandemic means that we have a new category of patient to look after. Those who may be or are affected by the coronavirus to varying degrees. That is primarily the responsibility of the isolation stream of our healthcare system. But because of the Queen Elizabeth Hospital by nature being our major point for the most severely ill to be cared for, we are the repository of the major expertise and equipment for saving lives. We obviously have to bridge the gap between being a non-COVID, non-infectious environment, which is what we try to do for our patients. And we are thankful that the public has largely worked with us in this respect. We know that the visiting restrictions that we have had to impose to try and keep the virus out of our wards has been difficult. But we also know that it has been successful, and we thank you for your cooperation. Our clinics have had to be scaled back through the use of telemedicine and the assistance of our Transitional Community Care Program, which is a new initiative to help the most vulnerable remain in their homes safely. But we know that when people are anxious, especially if they have been told or suspected that they are COVID positive, they will want to come to the hospital. That has been our culture. And the place of first contact is usually the Accident and Emergency Department. Because of the large volume of ill patients, both COVID ill and non-COVID ill, coming to our Accident and Emergency Department, we really cannot entertain people who are potentially infectious waiting for long times because of relatively low priority illnesses. So to address that, as you've heard from the Chief Medical Officer, there will be satellite areas for COVID and COVID suspect people who are in isolation or quarantine and who have concerns, so that you can avail yourself of health care there without taking the risk of coming to the Accident and Emergency Department, mingling with people who are potentially very ill and therefore able to spread the virus more than you would want. The new part of this virus, as it has affected us, is that not only are patients affected, but our staff. Like the country, we have had rolling numbers affecting various departments one at a time. So on a daily basis, we have had to shift the focus of providing resources to departments one at a time. Even with this, we have been able to maintain our emergency services and the basic care of the most vulnerable. This is in large part due to our surge planning, and we have to inform you that parts of the surge plan are operational in those departments most affected. So you will see a change in the wait time and the availability of many of the services that you are accustomed to, but they will return as soon as possible, and emergencies and genuine crises will always be taken care of. We ask, if you have any concerns, please to call our help desk 536-4800, where we have qualified health professionals standing by to address concerns without you showing up and taking the risk of being somewhere in person. As always, we are honored to partner with you in the care of your health. While we endeavor to do our part, we ask that you too follow the things that you know, can, and have worked to keep our country safe this far. Hand washing, vaccination and boostering, social distancing, and making informed choices so that you can minimize all the risk factors. We have vulnerable people in our population who depend on us all to look after them. We will work to fulfill our obligations. We thank you for doing yours too. Thank you, Lisa.
Very much, Dr. Cave. We now go to Dr. Grandison.
Hello, good evening, everyone. Since I would have last been on the press briefing, I am here now to allow you to know that home isolation is in its second wave, as we're all aware, with Omicron. And we continue to have a pattern of predominantly well persons in home isolation. We have a maximum at this point in time, based on our dashboard, 9,575 persons in the home isolation program, with over 3,426 of them being green. Since the commencement of the Omicron wave, our program has also changed a bit in terms of persons who are allowed to stay at home. Dr. George would have spoken in terms of a self-isolation component, and we are happy to say that this part of the program has been going quite seamlessly. And we continue to ask that if persons at any point in time should develop symptoms as they have, and they're concerned about, to please contact our call center or our operations center to gain care. Since this Omicron wave has started, the pattern for COVID has somewhat changed in terms of symptoms that patients may present with. We have seen persons with increased cases of vomiting and diarrhea for this particular wave. And so at this point in time, I would encourage persons that if at any point in time during their illness or the course of their illness, that they ensure to remain hydrated. How do you do that? In medicine, we usually say slow and steady wins the race. Quite often we think that if we have a large vomitus or a very large watery bowel movement, and we don't always feel like eating or drinking, that we just stay away from fluids. Or if we are going to take in fluids, that we need to do a very large amount in a short space of time. What I'm saying to you is take it nice and slow, small volumes of fluid to ensure that you do not become dehydrated. Also, during this period, we have had the greatest number of discharges for the program, and we continue to work quite valiantly. Our team is actually working around the clock 24 hours to ensure that persons are discharged in as timely a fashion as physically possible. However, if at any point in time you should develop symptoms in keeping with shortness of breath, feeling extremely weak and tired, having any episodes where the family members have noticed that you've lost consciousness or you have fainted, please certainly reach out for assistance. The Omicron wave has demonstrated that for the majority of persons, especially those who are vaccinated, that this course can be quite mild. However, given the background predominance of our NCDs, I also want to encourage the Barbadian public to pay attention to your non-COVID health. Monitoring your blood pressure, monitoring your blood sugars, and certainly eating better than ever before and sensibly is of utmost importance at this point in time. We also know that we have continued to have very minimal cases, although from a clinical standpoint, we consider it a lot. We have 8 deaths within our home isolation program, and in our opinion, that is 8 too much. And we would like to continue to keep our deaths within community as low as possible. Certainly, we will continue to provide care and access to care as much as we can. And we are happy to be moving in the direction of an assessment center that is dedicated for persons who are either COVID indeterminate. So you may have been in a household with someone and that person is positive. You are now displaying symptoms, but you do not have a confirmed PCR test. The assessment center that Dr. George would have spoken to is certainly of utmost importance because it allows a dedicated space for you to be assessed and managed as you are made aware of your COVID status. Also, I want to encourage persons that if they should at any point in time perform a rapid PCR test, whether at home or with any facility, especially if you have been symptomatic, to please follow up with a PCR test as soon as possible, because that is important in terms of us being able to monitor and fast track you through our system. And I really want to urge persons to continue to test as they are. I am happy to state that our refusal rate is at an all-time low. And this is the refusal of transport. And the last time that I came on the actual press briefing, I would have asked persons to really reconsider not refusing care. On our dashboard, we only have 80 persons who have refused care, especially during a very large Omicron wave. And I think that that is extremely commendable. It speaks to the importance that, as the Barbadian public is now aware, that this is not just a normal flu, but certainly it's not something for us to panic about. And also that our isolation facilities are there to provide you with the care that you need, and they do so quite competently. So at this point in time, I am going to stop and pass it back over to Dr. George or Lisa. Thank you, Lisa.
Dr. Granison, yes, we're going back to Dr. George.
Yeah, so I'm just going to follow up and mention three quick bits of information that the public needs to know. First, effective immediately, the quarantine period for persons is no longer 5 days. Quarantine is for 3 days, and you retest on the 4th day. This was instituted based on the epidemiology and the science of transmission of Omicron. So that if you are going to be in quarantine, you're quarantined. If you remember that you go into quarantine if you have been exposed. And if you are exposed, the quarantine period is 3 days, and you retest on day 4 to exit quarantine. The second bit of information I will leave with you is with respect to Harrison's Point and Sun Bay Hotel. We have a total of 151 individuals in those places, and within Harrison's Point facility specifically, there are 111 individuals. And most of those individuals are between primary A, primary B, but over 70% of those individuals are in secondary. The other issue is that the persons requiring oxygen, assisted ventilation, and ventilation is 18, and we only have 2 individuals who are on intubated and on complete ventilation at this time. The occupancy of Harrison's Point is between 35 and 40%. And finally, I will share with you today's results with respect to the level of disease that was reported on the 28th of January. There were 2,530 tests done. There were 613 new positive cases, and 12 persons will be released from isolation today. Thank you so much.
Thank you again, Dr. George. And as we open for questions, as customary, I'll just ask members of the media to identify themselves and the media house they represent before posing their questions.
Trevor Thorpe, CBC News. Home isolation are 9,575. How is the unit coping with this number to date?
Thank you very much, Mr. Thorpe. As you know, this is probably the highest number that we've had in home isolation. But I want to say that because of the change in the program, and especially the change has really been guided by the course of Omicron, but the change of the program into a partial self-isolation at home and a home isolation with monitoring has really allowed for us to be able to cope quite nicely with the home isolation program. There are still a number of persons that we continue to follow up on. And so at this point in time, I would say that it is stressed. it is stressed, but we are coping. It is not a situation where the numbers are overwhelming and we have essentially exhausted our human resource. But we look always for more efficient ways of handling the home isolation program with the use of technology. And every single day we have robust discussions about this, and we will hopefully soon be rolling out even another iteration to more efficiently manage the numbers and continue to cope with the numbers that we have.
You spoke of technology. What tickles my imagination is the electronic bracelets that were first mooted. Have they been put in place? And if so, if not, when can we expect them so as to combat the spread of this virus?
So the bracelets are not in place at this point in time, and it's simply because with over 3,000 persons that are in green and another close to 3,000 persons in the yellow category, you have approximately 6,000 persons at home. We don't think at this point in time that is probably the most effective way of keeping persons at home. Certainly what we have noticed is the vast majority of Barbadians actually abide by the rules and regulations. We do have some persons who probably, even if they had the bracelet and they had the opportunity to probably manipulate it, cut it off and not allow it to charge, they would probably still continue to roam Barbados. But for the vast majority of persons, they actually abide by the regulations and they have been keeping at home. What I will say as well is that here in Barbados, we have our own Caribbean security, where persons have called into our call centers and the actual ops center and have quietly informed us of some person that they may have seen walking around who they knew because they are checking in on their community, that this person is now roaming in the household, and we usually send our COVID monitoring unit to investigate these persons, and those persons are dealt with appropriately. But for the vast majority of cases, we don't have a challenge at this point in time.
Yes, good afternoon. Colville Munzi from Nation News. A question for Dr. George yes. The areas earmarked for satellite locations, have you identified those areas as yet?
Yes, we have identified those areas, and we will be making a pronouncement on the actual areas shortly. The areas were strategically chosen. One of the areas is in Belleville. One area is in the east, in St. Philip, and one of the areas are in the north of the island. The areas were carefully selected based on their ability to manage patients. Our teams did recce's to make sure that the outlay, etc., of those places are up to a minimum standard. And once the logistics have been completed, this can be actioned as early as next week. This is a good method, as I indicated, to give the Queen Elizabeth Hospital a buffer which is under stress. The Accident and Emergency Department is stressed because not only persons with COVID, but we also have to manage non-COVID cases. And therefore, if we have a step-down facility that can manage the moderate and mild cases, persons presenting acutely, and manage within those facilities, certainly this will assist in the stresses to the Queen Elizabeth Hospital at this point in time.
I have another question for the Minister of Health, Minister Ian Gooden-Edgell. I hope I'm not throwing you off at the deep end at this point. I know that you have only been sworn in just last week. This week, sorry. Now, the human resources are obviously inextricably linked to the ability of the healthcare system to manage this wave. However, we have an ongoing nursing strike at this point that has been dragging on for the better part of 8 weeks. Has there been any discussion thus far in how this is going to be addressed with some level of urgency?
Thank you. I certainly wouldn't allow you to throw me off. You would appreciate that I started receiving my briefings yesterday in the ministry, and therefore what I would like to suggest that those matters will be dealt with, and at the appropriate time we will speak to those matters. But I'm still taking my briefs. I know that the institutions are doing their utmost to maintain patient care, and that is ongoing. And you would have heard from others who've spoken before me about the work that they continue to do, notwithstanding our challenges. But we will deal with those matters at a later date.
And members of the media, Dr. Grandison wanted to jump in here.
I just wanted to inform persons, because I know there's a significant amount of panic, not a lot of panic, but a significant amount of panic in terms of how do you handle yourself as a COVID negative patient in the household of a COVID positive person. We have had a few unfortunate situations where persons would have become COVID positive and would have been asked to leave the home by their family members placed on the outside. Now, COVID is certainly not a death sentence, and there are persons who have been in households with COVID positive persons who have never caught COVID. Certainly, the use of face masks is optimal. You need to ensure that you have a proper fitted face mask. If you have to share a bathroom, then the bathroom needs to be sanitized. All frequently touched surfaces, for instance, handles, sink knobs, the toilet bowl flap that allows you to flush. All of these high touch surfaces are extremely important that you sanitize them. If you do not have the antibacterial wipes that you may have in the household, your Lysol wipes, your Clorox wipes, then certainly you can use good old Clorox and water and mix it appropriately so that you can actually sanitize these areas. I also encourage that persons who are isolating, so you're COVID positive, take the opportunity to be pampered a bit and allow someone who's not COVID positive to prepare your meals while you stay in your room, and allow them to bring the meals to you. Your meals should be brought most preferably in disposable containers if you can do that, or if you can't and you're going to have to use reusable, so your normal crockery that you have at home, certainly ensure that you wash with warm soap and water and put them to dry. During this time, you also want to ensure that if you, at any point in time, because mental health is very, very important, if you have to come out of the room, even if it's to go to the bathroom or to go to the window, please make sure that you have on your mask while you are in the presence of your other family members. For those of you who have a very tight home situation where you may be even sharing a room, methods such as sleeping head to toe can be used. Certainly turning away from the person that you're sleeping in the bed with. And I know that there is the very unique situation of mummy and child. Certainly if the mummy is breastfeeding that child and the child is not COVID positive, mummy should be wearing her face mask with the baby in the household while she's breastfeeding the child. Mummy does not have to not breastfeed the baby. She can continue to breastfeed. It's just that she needs to continue to protect the child by putting on her face mask. So here are a few tips really to assist the public with coping with COVID inside of the home.
Thank you, Dr. Grandison. Colville, I'm not sure if you had a follow-up.
Yes, I had another question for Dr. George. I know that you would have mentioned that the Harrison's Point is at 40% capacity at this point, and I know we do have some international figures as it relates to the level at which Omicron, how severe, Omicron is at this stage as opposed to the Delta variant. What I want to know is what is the data showing on the ground? Or what is the rate at which persons are falling severely ill during this Omicron wave as opposed to during the Delta wave? Is it comparable in any way?
I'm going to try to answer you. Although it's the same virus, it is two genetic forms which are actually quite different from each other. And therefore, although we learned from the experiences during the Delta wave, we cannot simply transpose it to the Omicron wave. As Dr. Grandison has indicated, a couple of things. The presentation is slightly different. And the reason why the numbers are down in HP is that many times persons are not presenting with the respiratory distress or respiratory failure that occurred with Delta. We had situations in the hospital where persons were coming into QEH unable to breathe, and those persons indeed had poorer outcomes. The other thing about Omicron is it's the same species, but it's a different form. So that the level, when you're exposed to Omicron today, within 2 to 3 days, you can become infected and later infectious. So that what we did in the Omicron surge plan is took out the key elements that we can add to the value of this plan, fully understanding that this Omicron was a unique virus or unique subset of the virus, and we tried to work with that. The issue of Omicron, it is extremely infectious, and therefore I am suggesting, and this has been discussed in the EOC, and I will add this to Dr. Grandison's comment, that persons within households who have positive and negative cases, those persons should wear double masks. Why? Because it is so much easy to transmit virus within close quarters. And this can be extended to individuals in the household, particularly if you are either overweight or have NCDs. While I am speaking, we also indicated that this virus tends to present with pre-renal failure, and pre-renal failure is usually triggered by first the onset of dehydration, and therefore that is why Dr. Grandison indicated some points to make sure that persons remain hydrated during this wave. So experiences were learned, yes, but you can't transpose all of those experiences to what is currently happening on ground now. Thank you.
Next question.
No. And Dr. Trevor Thorpe, sorry, beg your pardon. Go ahead, COVID.
All right, final question from me, and this one is for Dr. Cave. Normally, we not after the wave of COVID, we normally expect an NCD wave as well. Are we on course for this time around? And what is the feedback that you are getting at this moment, especially with the outpatient clinics being somewhat stymied? What are you seeing on the ground?
Yes, that's a very perceptive question. Our Barbadian population has a large proportion of elderly, and elderly people who are overweight have diabetes and hypertension. And we know that many of those people, while doing their best to follow the COVID protection protocols, have stayed away from the kind of health care that they would normally receive. And yes, we are seeing, as we saw after the Delta wave, that a large number of people are presenting in greater need than we would have anticipated. As Dr. George has said, there may be an additional effect of the Omicron virus specifically on people. So we have two streams of people who are in need of care. Those with chronic non-communicable diseases who have gotten worse faster than expected, possibly because they haven't availed themselves of the usual care, and those who have been relatively well, but their whole system is now challenged with an Omicron infection, which is why every effort, even for those who are not infected, but elderly and vulnerable, to take the precautions of diet, activity, and above all, hydration. And should there be any questions in a deviation of your help, health, please call our hotline where the professionals can help you negotiate the system to find the care that you need.
Trevor, you had a final question?
Yes, Dr. Cave, the doctors are working long hours, and how are you planning to avert this burnout that they're having? And two, the resignation of nurses added to the problems.
Thank you very much for that question. In the beginning of the COVID pandemic, we felt the love of the public, you know, the banging of pots and the saying thank you on a mass scale. As people have become more and more involved in their own lives, that hasn't been quite so much in evidence. And yes, all our healthcare workers are tired. We've been doing this for nearly 2 years. Our healthcare workers, like everyone else in the country, have family members or themselves have been personally touched by COVID as an infection, or touched as a spin-off by unemployment of other family members because of closed institutions. So yes, our workers are under tremendous strain. We're not a big country where we can call on unemployed doctors or nurses. We've already done that. I think all the people who are able to help are already doing so. Our policies have to be on trying to protect our own. As healthcare providers, we always rise to an emergency. The problem here is prolonged emergencies. So whenever there seems to be a space between waves, that's when we're taking the opportunity for people to have vacations. We're trying to get people to address their physical health, but also their psychological and mental well-being. You're quite right, it has taken a toll, like people in the country, on the healthcare workers. And I really do appreciate your acknowledging that. Thank you so much.
We do have one. Go ahead, Trevor.
Before you go, we've got a number of visitors with King Cricket in Barbados, and they're not wearing masks at the Oval. 60% is the head count for the Oval, but we've got a lot of folk down there not wearing masks. What can we do to help stem this area for a surge in the Omicron variant or whatever variant may be blowing around?
Perhaps I'm not the right person to answer that. As you will appreciate, our medicine is on the individual level, and certainly I can always urge everyone, visitor or local, to wear a mask. When in doubt, to double mask, wherever possible, social distance. But as far as the public health measures as to how we encourage this or enforce this on a mass scale, the public health officials are better poised to answer that.
Dr. George will actually take that question. Dr. George will take that question, Trevor.
Okay.
The cricket is going on, and we are happy about that. There will be, from time to time, persons who don't observe or breach our protocols. Let me assure you that there is the party stand, and the party stand was allowed persons without masks because those individuals both had to show proof of vaccination and were tested within 24 hours of entry. If you test negative on rapid antigen tests within 24 hours of entry, your likelihood of you having COVID at the time is extremely small. And therefore, it was only allowed a specific subset of persons in Kensington. And those individuals should be showing proof of vaccination plus having a rapid antigen test. In addition, we also instituted rapid antigen tests for all workers associated with cricket. But I'm glad that you have brought this to my attention because this should not occur in the other stands. And I will certainly be chatting with Mr. Chapman and his team to see how we can manage this situation. Thank you.
And we do have one final question that has come in for Dr. Grandison regarding the level of discharges. Dr. Grandison?
Thank you, Lisa. I do apologize for not mentioning this before, but our total amount of discharges at this time stands at 17,287. 17,287.
Thank you very much. And the new minister, do you have any closing comments, sir?
Thank you, Lisa. And let me also thank members present here at the table and who join us for this media briefing. I want to express my deep gratitude to you for taking the time out to address the country. Let me say that I would also want to thank the public for their continued adherence to the protocols and other control measures that we have in place. This is critical in our fight and certainly in our resolve to make sure we minimize the impact of COVID within the community. I would ask the public that they continue to be very patient with their healthcare professionals and give them their utmost cooperation. The ministry's team remains committed to getting us through this challenge. We have done so in the past, and I'm very confident that the ministry's team, along with all the supporting participants in this exercise, will do us just proud. And on that basis, I want to assure the country that the ministry will continue with its communication. We will, as needed and as necessary, report to the public on matters of urgent concern. But we also ask for your continued cooperation, especially in working with our healthcare professionals who continue to do us and make us proud. I thank you.
Thank you very much. That was the Minister of Health and Wellness, the Honorable Ian Gooding-Edgell. Let me also thank the Chief Medical Officer, the Most Honorable Dr. Kenneth George, the Director of Medical Services at the Queen Elizabeth Hospital, Dr. Clyde Cave, Consultant Manager of Home Isolation, Dr. Adana Grandison, members of the media, and you for joining. Good evening.